Good afternoon.
Thank
Welcome
you.
back to Rising Up with Robbie. I have another very special
Hi.
guest today, Shakira. From
Hi.
Shakira is a registered nurse of 22 years, so she's
Hi.
very experienced. And we're going to talk about home health today. What it is, how you get it, what some of the qualifiers are, and a little bit about her job. So, Shakira, I'm going to let you take over. Shakira, can you hear
Right.
me?
Well, again, yes, my name is, yes. Can you hear me?
I can.
Okay, great, great. Yes, ma'am. Well, actually, yes, I'm a registered nurse. I've been in the nursing industry for over 22 years. Can you hear me okay, Miss Robbie?
Sure can.
Okay, great. So yes, I've been in the industry for over 22 years. I started out as a licensed vocational nurse. I went and went to school with a bridge over program, and I got my degree in nursing to be a registered nurse. Okay, I started out some time ago. I was actually my brother was he was born with some brain damage. So
Oh,
I ended up being his nurse when I was younger, even before I was a nurse. He had a trach, he had a G tube, he had some issues going on. So my mom, which is actually a nurse as well, taught me, showed me some things to do to care for him, and that's how I kind of got into this, into the nursing industry. My brother.
good
Uh,
reason.
yes. So as far as home health, you can get home health after usually being hospitalized, or if you're going to the doctor to be treated for some type of disease process that actually has not been able to be controlled by yourself independently. Okay. So basically, the doctor may say, I want, a nurse to come and teach you and educate you on ways to help you get better, and also on ways to stay out of the hospital, actually.
Hmm.
Mm-hmm.
What about
Okay.
providing care? Nurses also provide care?
Oh, yes, absolutely. We actually go there when we do the assessment for what, for the patient or whatever, that depending on what the patient needs. We'll go as many times as we need to actually stabilize, get things stabilized, or to get the patient to, get better. We do an array of different things. We do wound care if we need wound care. We will administer medications, IV medications, um, physical work. We also, but mainly we're there to educate and to actually treat whatever exacerbation of the symptoms that's going on.
Okay. So, is there a time limit on how many visits a person can get and how much time is allowed in the home? Is there any kind of a limit on that?
There's no real limit, basically. Well, they try to say no more than an hour. Hopefully, you're not there too long, because they try to, because they know you have other patients to see. But most of the time, we're there until we finish completing whatever task it is that we're doing. So, for on average, the visits at average between 30 minutes to a little over an hour.
Okay. Okay. Now, you talked a little bit about the qualifiers. Are there specific Medicare compliance issues that you have to follow with getting people into home health?
Absolutely. Basically, Medicare guidelines are as follows: the patient has to be homebound in order to receive the home health services. So, if the patient can actively go to the doctor independently and don't have any taxing effort to go, then they don't need home health. But if the patient has a taxing effort, i.e., a wound, or decreased mobility, or some condition that prohibits them to frequently go to the doctor easily, then they qualify for home health.
Okay, thank you. Because
Mm-hmm.
that can get really confusing. And if I remember correctly, with Medicare, you have to have a qualifying illness? And is there a qualifying hospital stay, like so many days? I'm just not
No,
remembering.
yeah, no, not for home health, actually. No, for home health, the only qualifier you really need to have, and it just kind of depends. I don't want to confuse you because there are some instances where you don't actually have to be homebound, but you can actually receive the services depending on the insurance. But as
Uh-huh.
far as Medicare, you must be homebound and you don't have to have any specific disease process. Just the main thing is the insurance, a doctor's order, and actually if you you can't just make it to the doctor.
Okay, okay.
Mm-hmm.
Yeah, kind of like me with being a bilateral amputee,
Mm-hmm.
even though I have some mobility, it's really hard for me to get to and from a doctor. And I guess you could say I'm more homebound than anything. Is that right?
Yes, that's
Okay.
correct. Homebound basically means, in the eyes of Medicare, that it's a taxing effort. Like it's just not easy for you to go, and also that it just you can get the services brought to you, and as opposed to going to the doctor 2 or 3 times. Just say, for instance, you have wound care, and the doctor wants you to get wound care every day. Well, you're not
Hmm.
going to want to be able to go to the doctor every single day with the wound. So that's where home health plays the part of getting you healed without placing you at risk for further injury or infection by trying to go outside.
I understand. I know it can be very particular, I guess the word would be. So I appreciate you clarifying that for us. So
Yes.
tell me, because I get home health, I get wound care, I get OT, occupational therapy, and I get physical therapy. And I noticed that every month or so, I have to be reevaluated for the treatment, for the services to be approved. Am I understanding that correctly?
That's correct. Usually, every 60 days, you have to go through a recertification process. This basically verifies that you still continually need the services that was originally written by the doctor. So, for example, usually if the registered nurse like myself will come in and do the assessment to see if you qualify, basically we're looking at, have there been any medication changes? Do you still need instruction to stay healthy and to stay out of the hospital? Or has the wound healed completely? If the wound has healed completely, then the registered nurse come in and do the assessment to determine that, we need to go ahead and discharge. And that way we
Uh-huh.
will no longer be billing your insurance. So yeah, every 60 day there's this particular process.
Okay. Well, that
Hmm.
clarifies that, and that makes sense because things can happen very quickly.
It can
Changes can
go
occur.
right. And that goes either way. A nurse may be coming in, a registered nurse to come in to do the assessment to actually see if you still need them, if you need more services, i.e., if maybe you didn't have occupational therapy at first and you may need it now, or maybe you had physical therapy and maybe you need occupational, or maybe the current treatment that we've been doing have not been working well, and at this
Uh-huh.
point, we need to increase the visits, or maybe at that time, contact the doctor to see if there's additional things we can do to get you better faster.
Okay. Now,
Mm-hmm.
it's my understanding too, there are basically two more therapies, a speech therapy, and I don't know about a respiratory therapy. Is that included in home health?
Not really. I have not seen home health include respiratory therapy, not to my personal knowledge. I have heard of it, but that's usually in the hospitals. I
Uh-huh.
haven't seen it delivered outside the home. I mean, outside of the hospital. However, they do. Speech therapy is very common.
Okay. Okay.
Mm-hmm.
And speech therapy not only helps with speaking, but it also helps with swallowing, chewing and swallowing, I understand.
Yes,
Yeah.
ma'am. If we go into an assessment and the patient is saying basically they're having trouble swallowing, that is usually the first assessment that they'll have to go. They'll get a speech therapy to go, and that kind of that'll give them the indication on what the patient needs help with, swallowing or speaking, and then they'll develop a care plan based on that.
Yeah, there was one point in my hospitalization that I had difficulty swallowing, probably more because I was so debilitated. Um, but one of the first things they found out was that I needed to drink more water because my mouth was dry and therefore I couldn't swallow very well. So
Right,
you never know what the issue might be. And that's why it takes
right.
you guys that have the specialties to come in and help us. I mean, I've been a registered nurse for going on 53 years. And yeah, I know it's older than dirt. And yeah,
Not true.
I don't know everything. I'd like to pretend that I do, but I
Right.
typically don't. And I'm learning every day. So your job primarily, if I get it wrong, let me know, is to go in and do those reevaluations and assess whether or not the patient can continue with therapy. Is that right?
I go in and do the initial assessment as well as to see if they even qualify for the services or need them, in addition to reassessing to see if they need the continued services. So pretty much in a nutshell.
Okay.
Um, and also a real important job for home health, which is really important, which is really what I want to start focusing on, is to see if there's any duplication of medication therapy. That's one of the main things you want to check, because a lot of times that the patients are seeing different doctors
Yes.
and they don't reconcile the meds, not that they just didn't, but because is we just can't keep up with all the doctors that are being seen,
Right.
and it's really hard for each to communicate, even though the system tries its best to. So we go in and we may see several times I've caught a patient on 3 or 4 diuretics, or
Oh,
that they shouldn't be on, or 4 or 5 different medications. And with that being said, they're falling. They don't know why I'm falling or I'm dizzy. And then I go to the meds and I saw that 3 different doctors prescribed 3 different things, treating the same disease process, but they didn't know. So it
yeah,
takes the nurse to go in to take a look and see, about the medications, and to make sure there's no duplication there.
sure. Or I imagine you find situations of what we call polypharmacy, where the patient's on a multitude of drugs. And I mean, at one time I
Absolutely.
was taking 14 drugs a day, and
Yes.
that's too many.
It's too many. And on top of that, just because the doctor, or you in the hospital, they give you all these different medications. Once you get home and you get reevaluated by a medical professional, we make suggestions on how to carry on. So at that point, you should be getting better. So even though you were in a hospital and you were on 10 or 15 meds, by the time you get home and we teach you how to eat, how to, take your medications, you should be getting better. So at some point, some of those medications should be dropping off. You shouldn't continue to be taking the same medications if you are improving. So that's part of our assessment as well.
Oh, that's good to know. We
Mm-hmm.
appreciate that because that's a huge issue, especially with our seniors. I happen to be a senior, and we have typically a lot of complaints and many times several comorbidities, which means different diseases that may react well with each other and they may not. And so your assessment of that issue is extremely important.
Yes. Yes.
Yeah.
Mm-hmm. So I think I know it could be, it seems like sometimes the nurse is in and out, and sometimes the patients are, we're allowed to do the assessment. We have to do the assessment. We have to do the reassessment, but we also have to do supervisory visits as well. Usually every 2 weeks, depending on if the particular patient is getting home health aid or additional home health services, so that we can make sure the patient is getting, everything that they need.
And so
and not
that's what,
more or
that's
less.
what's involved in the supervisory position, is you just go in and assess if everything's working or they're
Yeah, you
getting what
go
they
in.
need.
Basically, that supervisory visit is a little different from the assessments. It's actually to see if the person that we're supervising, say the CNA or either the LVN, are they delivering the services, as ordered. So we'll come
Okay.
to you every couple of weeks or once a month, and we ask you, did the home health have the home health aide been showing up? How do you like them? Because you're not going to tell the home health aide or the LVN that you don't really, like their particular services, but you'll tell someone else so that we can get
That's
someone
true.
else to come and see you. So that's
That's
what that
true.
visit is for. Mm-hmm.
Yeah. Well, that's a good visit too. Your job is very critical to our care. Um,
Thank you.
I, I lived in Anahuac before I moved out here, and I remember trying to get home health because I had a massive wound, and I couldn't get it because there was nobody in the area that serviced my area. And I tried diligently to take care of it, but I couldn't. I
Right,
couldn't.
right,
I
right.
was ready just to hire a private nurse to help me, um,
Mm-hmm.
and had actually talked to someone about it. But then, and all of God's blessings, the company decided they would do it. And
Yay.
yay, yeah,
That
you do you do have you guys do have heart and a lot of it.
right. Yeah, it takes I think it takes a special kind of person to drive around and do it, but it is very, very rewarding. It is taxing. I won't tell anybody it's not. But if I had, I mean, you get instant rewards, honestly, with nursing. You can
Oh
instantly
yeah,
make something better. You go in
yep,
there, someone is hurting, you can fix it pretty
that's
much,
right. That's right.
Yes. Mm-hmm.
Yeah, I know too. You can see a lot of patients in a day. I was talking
Yeah.
to my wound care nurse because Thanksgiving, threw her schedule off because she typically came to see me on a Thursday. And so she was going to come see me, I think that Monday after. Or I called her to see if she could see me that Monday. And she said, Robbie, I have 16 patients today, which is
Yeah.
a big load. So I
And on top
understood.
of the, I'm sorry.
No, no, go ahead. Go ahead.
On top of the 16 patients that she has to see, on top, she has to drive to each one of them, do the care. Then she has to complete the documentation for 16 patients. So it can be very taxing. Yes.
Yes, it can. Yeah, I
Mm-hmm.
worked home health in the early 80s, not for very long because I found that it wasn't my cup of tea. But I remember back then it was the Oasis
Mm-hmm.
documentation. Um, oh my word, what was it, like 12 pages long? I don't remember, but the documentation is intense, but it's
It's
also very
intense,
important.
very important, very intense, and it's up to 30 pages now at the Oasis.
Oh,
It's 30 page for each assessment. So the initial assessment and the recertification assessment are the long ones. I mean, you're going to sit there hour and a half to 2 hours just trying to get the paperwork in.
oh wow. Yeah.
If you do it accurately, because you have to address all the systems.
And you must do it accurately. I
Yes.
mean, as nurses, we can't miss a beat. Um, the old adage, if it's not documented, it wasn't done.
It wasn't
And
done.
documentation is one thing that gets people in the most trouble. I did legal nurse consulting where I read uh, reviewed patient records for attorneys to see if they had a case. And
Mm-hmm.
I would say that 90% of the cases had to do with documentation or failure to document. The rest were medications. So,
Wow.
yeah, it
Hmm.
was an interesting job, but it was also tedious.
Very much so. But one thing about it is in the hospital, it's easier to get a handle on medications, but it is so hard to get an accurate handle on medications in the home because you're always constantly maybe, oh, I'll pick up a Tylenol or I'll pick up a vitamin or something, and you don't really count it. But it's so important to count it because some things really counteracts with, regular, over the, regular medication. So yes,
Absolutely.
that's also hard to keep up with. But yeah, we do our best and we communicate with the doctors. Another thing that we do is when we come in and do our assessment or even our regular skilled nursing visit, any abnormalities at that point, we immediately call the doctor. Say, for instance, we're doing wound care and we notice that there's a darkened area, there's more drainage, more blood, more odor. Immediately, we call the doctor.
Hmm.
If we come in and we see an abnormal blood pressure, we immediately call the doctor because, again, our goal is to keep you out of the hospital and to get you, as well and stable as possible. So that is another key factor in the home health nursing to kind of get you, the constant coordination between the doctor, since you don't go see them that often, maybe once a month or so.
You have a lot of plates in the air on a stick trying to rotate them. Yeah.
Absolutely. Absolutely.
Well, Shakira, is there anything else you would like to tell the audience about your job, about home health, about taking care of people in the home?
Well, I would like to end with saying that I think it's a group effort. I think the nurses coming to see you. I think it's a pleasure. It's an absolute service to be able to serve. But I want everyone to know that it takes both of us. If we come
Uh-huh.
in and educate, if you could be, once you're receptive, if you can actually um, initiate some of the things that we're talking about, maybe, it'll help, everyone get more stable. It'll help us get better. Our goal is to get you off of as many medications as possible. So if you could take heed, maybe do some research, or at least maybe control your diet, try to take your medications on time. This could really that would make our job easy, better. Oh, sorry.
Uh-huh.
Sorry, come out.
Well, you're constantly helping us. And
Yes.
as a patient, I truly appreciate it because you've got a tough job and you're a dedicated professional. And, um, you know, I'm going to say something that I might get slapped about, but in especially hospitals today, we don't see that much heart and dedication anymore. I know because I've experienced the good, the bad, and the ugly. Um, and as an educator, that really disturbs me. And I don't understand how.
I've seen it too, and I see it too, and I try. They say the man in the mirror. I try my best to to treat every patient as if it was a family member of mine, because
Right.
I do see there's a lack of compassion. I think our job as medical professionals are to bring light, and I think, and to leave all the other stuff at the door. So I think it needs to
Absolutely.
be absolute. I think it needs to be more of that. So I feel it too. I do see that there's not a lot of compassion, but I also see the other side as well, where I see nurses go above and beyond to do it, to go there. So I'm glad at least there's a little bit of a balance, you
Oh, I
know.
agree. Yeah, I agree.
Right.
Because
But
I have seen good.
right. But a lot of that is just overwork. It's
Uh-huh.
burnout. I don't, I'm not giving them an excuse, but I think it's a cause and effect
Yeah,
thing. So that's why I would hope all of us just work together, medical professionals and the patients. Let's work together to get us better. So there's not so
absolutely.
many patients, so there won't be so many. So I would like to leave with saying if we can eat better, maybe manage stress better, maybe love a little bit more, I think we'll be okay.
I totally agree with that philosophy. Well,
Uh,
Shakira, I truly appreciate you taking your time out of a busy day to come on to the podcast and talk about home health. I appreciate it because a lot of the audience don't really understand what home health is for. So thank you for taking the time. And as usual, to you guys out in the audience, if you have any comments, any questions, please post them in the bottom in the comments section. Again, I will answer them generally within 24 hours, if not sooner. So please feel free to do that. The other thing is, if you would, please subscribe to my channel so I can continue bringing important guests like Shakira. And I appreciate the time that you give me every month. And I'd like to thank Shakira once again. She's an ultimate professional and a very caring individual. So thank you, Shakira.
my
And I
pleasure.
thank you. And I wish everyone well. Take care and have a wonderful, wonderful week. Bye bye.
Bye bye. Thank you.